My name's Anand Sivanand, and I'm a consultant clinical oncologist here in Nottingham. I would have loved to have also presented alongside my colleagues, Judy Christian, who's a clinical oncologist and also one of our patient reps, as we were planning in March, but I'm doing this solo, so I hope to do them justice. So I'm going to talk about the project we've been involved here in oncology in Nottingham, which is a district general hospital and tertiary centre in the East Midlands, and how we've embraced digital technology to improve the experience for our patients. So next slide, please. So this is the problem we're all facing in the NHS. In the decade preceding when we started our project, as you can see here, appointments in the NHS in England have gone from 60 to 120 million, so doubling. And as we all know, the demand has doubled, but our capacity to deal with that demand hasn't doubled to the same extent, leading to issues in terms of patient experience. Next slide, please. So thinking about strategies as a department to improve on this, we thought digital. And why did we think digital is a way to improve things for our patients and staff? Next slide, please. So our drive is improving clinical outcomes for our patients by reducing unnecessary appointments and targeting resources to those that needed it most, improving experience for patients, giving them more control over their time and cost, and particularly for our group of patients, reducing risk to them. So these patients are often immunocompromised, so by reducing the need to come to hospital, we're reducing their risk of infection. And it's not just us saying this, we've got high-level organisations such as the Royal College of Physicians who believe the way we've done outpatients is outdated. These stats were shocking to me when I read this report. 20% of our older patients feel worse just from attending their appointment alone, not taking into account what actually happens at our appointment. And 5% of all road traffic is NHS related, and outpatient activity is a huge makeup of our NHS activity, so anything we could do to help this would obviously have significant benefits. So thinking about our ambition, we decided to approach our redesign of our outpatient services from the patient perspective. If you were the cancer patient having treatment, how would you design the outpatient department? Next slide, please. And talking to our patients through patient focus groups and structured interviews, we had a real sense from them of actually could they have their consultations at home if needed. Next slide, please. And these are some quotations we've got from our patients before we started doing our project. And you know, for someone who does a lot of work in hospital, you know, things like this do really make you stop and think. We're all very busy, but to our patients who receive bad news, hospital isn't the most friendly place. So if you could do that in the comfort of their home where they feel safe, obviously lead to, you know, huge benefits to them. Next slide, please. So this led on to us using virtual video clinics using a secure platform. Next slide, please. So we're a centre for the region for treating patients with brain metastases, so cancer that spreads to the brain. And we have patients that travel all across the region to come to Nottingham. And these are a frail group of patients who actually can't drive. So attending a hospital appointment is a significant burden to them. So in the last 2 years, we've run a pilot of doing video consultations for those patients that want it, of which that's nearly 40% of our patient cohort. And by conducting a pilot and then evaluating that, we found that those that did the video clinic pilot, 100% of those were satisfied. Not a single patient felt that anything was missed, and almost all of them wanted to continue on with video follow-up. In terms of tangible benefits, in terms of data, we found that on average, nearly 2 hours was saved per visit. On average, patients saved 60 miles of travel with a cost of £16 per visit. Next slide, please. And what did our patients say? So we had an 88-year-old who was very grateful to ensure that he could continue to care for his wife and receive medical care via his video clinic appointment, and also the stress of attending clinic and the cost saving that Anne here has said. Next slide, please. And the other digital initiative we've used in the last 18 months is digital PROMs, or digital patient reported outcome measures, or digital questionnaire clinics. Next slide, please. And in cancer care, a lot of our patients are obviously on treatment, and that involves potentially 4, 3, or even 2 weekly appointments to monitor them and make sure they're safe to continue on their cancer treatment. obviously that's a huge burden to patients, and so we thought we could evaluate patients at home using digital questionnaires, and those that were safe to continue with their cancer treatment didn't need to come to hospital. Next slide. So we worked with our digital technology department in Nottingham alongside our technology partner Dr. Doctor, where we designed questionnaires in tandem with clinicians and patients, where patients could answer their questionnaires on their symptoms at home, delivered through their smartphone. Next slide, please. And you can just scroll through that. Thank you. And those questionnaires flowed from the smartphone on the patient side to then a secure digital portal that could be viewed by a clinician in a digital clinic, or a digital review clinic as we call it. And then if you scroll through that slide, that shows you how the questionnaire looks on the patient side, and then how we review it as the clinicians. So, you know, obviously oncology, we've got very, you know, we were very careful before we started going live with this. So we did a validation study and did our questionnaires flag up correctly. Next, continue on with the slide, thank you. And 97% of those questionnaires flagged up correctly. There were 3% that were low to moderate symptoms, where there was a discrepancy. So that led to some further refinement with our patient cohort, and also some additional fail-safe, such as a 24 triage line number that any patient could call if they had any concerns. Next slide, please. So we've been live now for the last 18 months. I apologise, this data is back from our presentation in May. So we've been live in a couple of cancer treatment pathways, and we've had almost half of our patients on a digital pathway. Our questionnaire completion rate is over 99%, so equatable to a DNA rate of less than 1%. So to any of those that do outpatient appointments, that is, you know, we were very pleased with that figure. And of those patients that did a digital review or digital appointment, 95% of those did not need a hospital appointment face-to-face. And we to date have not had a single adverse event, which is obviously pleasing to hear as well. Yes, next slide, please. And then obviously this is a PENNA award nomination. So how did we improve patient experience? So we sought feedback from our patients in terms of usability and content of the questionnaires. And as you can see there, you know, the vast majority were very happy with that. And next slide, please. And we asked them, would they be happy to routinely use these questionnaires to supplement their care? And as you can see there, the vast majority wanted to. But as you can see, there's a couple of patients down the end that weren't so keen, and we found out those are patients who were not had access to internet or smartphones. And obviously this led, you know, informed us that this shouldn't be an absolute either or. This is something that we should offer to patients, but face-to-face care is obviously still needed. Next slide, please. We compared after 6 months of our pilot face-to-face clinics to digital clinics, and you know, pleasingly, both our face-to-face and digital clinics were both found to be useful and were led to patient satisfaction. But as you can see here, our digital clinics, obviously our outcomes were even more impressive, which is obviously pleasing to hear. And then going in between the numbers and what's the patient data, here are some of our patient quotes, which are obviously very pleasing to hear. Can we go next slide, please? So in terms of, by considering how treatment should be for a patient with cancer, that has led us to embracing digital technology. And I think as our data has shown, we've led to improvements not just in patient experience, but patient outcomes, and also improvements to staff as well. I'm pleased to say that we're rolling out these pathways at speed across our department in oncology, but also across the trust with a number of other specialties now up and running. And I've also had you know, lovely chats with other colleagues across the NHS with hopes to then roll this out, both video, as we all know, we're very familiar with that now, but also our digital prom clinics as well. Next slide, please. So thank you very much. I've tried to run to time, and I'd like to thank all my colleagues and patients and our support from our partners there listed on that slide. Thank you very much.